A warm good evening to the galaxies of intellectuals, invited guests, professors, students, ladies and gentlemen. I'm Beena Acharya, and on behalf of Icon Life Sciences, I feel extremely delighted to offer a gracious welcome to all of you in today's webinar, where our esteemed chairperson as well as our speakers will share their experiences and learning from COVID pandemic from mental health perspective. Before we get into, I would like to go over a few items so you know how to participate in today's webinar. You'll have the opportunity to submit your question and answer in a text format in the Q&A sections available at the bottom panel of Zoom control panel. And you may also ask questions by raising your hands at the end of the session itself. We will be allowing you to interact personally with the speakers as well. So as I begin today's session, ladies and gentlemen, it's my honor to introduce our chairperson for the tonight, Dr. Rajendra Barve. Dr. Rajendra Barve, it's truly a multi-potential, multifaceted personality. Dr. Rajendra is a consultant psychiatrist practicing in Mumbai for last 40 years. He is the past president of Bombay Psychiatry Society, and he's a recipient of prestigious Satyayushi Award by Trans-Asian Chamber of Commerce for his meritorious work in the field of mental health awareness in India. He is quite passionate, inspirational TEDx speaker. He has lectured in several countries across the globe. To name few, countries are London, Tokyo, Bangkok, Colombo, on the topic of mindfulness. He has also received awards as a mindful teacher from Pagoda Meditation Center, Colombo, and he's also known as Sukat Acharya. He is also associated with various management school as a teacher for the topics of organization behaviors as well as in soft skills. He's an author of 30 books on mental health, harmony and happiness, which have been published in Marathi language. He's also so connected and he's like always connecting the dots in the field of mental health, running around, busy, quite available across. He was also running very successfully a dial-in show, which was called as Star Maza for nearly half a decade on a news channel as well. So ladies and gentlemen, it's my pleasure I request all of you to join me in welcoming Dr. Rajendra Barve. Sir, may I now request you to take over the session, please?
Thank you. Thank you, Veena, very much. It's real indeed great pleasure and honor and privilege to preside over this galaxy of speakers, wonderful colleagues and friends from Mumbai as well as from Kolkata and other places. So we bring on the table experience of various kind, and for a mental health professional, personal experiences and experience with people and patients is a very, very important aspect of learning. So when these people from ICON, they contacted me and asked me, shall we have a webinar? So I suggested, why not have a webinar on COVID and the experience of COVID? Because I have personally gone through various kinds of experiences, spectrum of experiences that I've had. And I thought it's time that we wake up to the new reality called new normal. The word new normal was used in 1966, when there is a novel on lunar, the people who lived on the moon. So we are in a way connected to new normal because we come from the field of so-called lunatics. So we are connected to it. But later on, the phrase became very popular after 2008, because that statement, which the economists made, which makes tremendous, they said, after a crisis of this kind, like a pandemic or the cash crisis which happened then, economic crisis that happened then, don't expect that everything will go back to normal. Everything will go back to square one, and we do just have to go back and start again. This is not going to happen. We have to define what is normal, what is the way of living and the way of spending life. And this is absolutely apt for COVID, because we see the waves of COVID pandemic And Mumbai, incidentally, is going through a very, very challenging time, and there is a sword on our head, like of a lockdown again. So we are, challenging times, and in these challenging times, it's best to be with people and be with colleagues and friends and learn what it was like and what have they learned from these experiences. So it can be a personal experience as well as a very professional insight that we have derived through this time. So it's like going back to school, and I think psychiatry best learn around a coffee table, better it is. So we have various speakers, and they have chosen topics which interest them the most. So the order of speakers is going to be Dr. Hina, then Dr. Ranjan, then Dr. Praveen, Rahul, and then Dr. Ruksheda. All of them are great friends, and I will like to introduce them as briefly as possible because I believe all of us are very well known. So let's not spend time in just telling each other how great we are. But I can't help, and I have to say that Dr. Hina Merchant, she's a associate professor in Department of Psychiatry at Sion Hospital. She has done a lot of work she's from GS Medical College, KM Hospital, and she was a research officer, and she was in the United Kingdom. She has 3 years experience of specialty training in psychiatry, and she's back again with us, and she is working in a general hospital. And I think what we discussed with Hina was what it is like to be part of a very close encounter with COVID patients, very, very close encounter with people who are actually the frontline workers, the residents who are working in San Hospital, and what it is like for them to understand and be personally involved in the process of treating as well as learning from COVID pandemic. So over to Dr. Hina. We have time limits, so we have about 7 minutes for each one, so that we have a good interaction, and then we can have a good question answer session. So let's start with Dr. Hina.
Thank you, Dr. Barve. At the outset, I want to thank Icon Pharmaceuticals for inviting me here. So the topic given to me is about COVID and sharing personal experiences. I take this platform today to be the voice of all the resident doctors, not just at Sion Hospital, in the psychiatry department, in the other departments, in Maharashtra, and all over the country. I think they are our unsung heroes. And without our medical residents, without them, I do not think we would have been able to face this enemy the way we are today. So I think whatever I say is really less. So once again, thank you so much for letting me be their voice. I have spoken to a couple of residents, not just in my department, but also from other hospitals and other allied fields. But I think I'll predominantly stick to how the residents who are undergoing psychiatric training, what have been their experiences. So I think I'm going to start off with by talking about the various cadres of residents they are. So starting from the third years, like this was the exam going batch. So we all know that COVID came into our life last year in the month of March 2020. This was actually the time when our third years had actually gone on exam leave or preparatory leave that we call. So when COVID started and there was a lot of uncertainty, we were told to call them back. Many of them had gone back home. There was interstate lockdown. They had a lot of difficulty in joining. Having said that, the punitive attitude of the authorities towards them, that if you do not join, maybe we would be taking some strict action that would, hamper your registration regarding your exam. And once you have already finished your post-graduation, comes the time when you have to serve your PG bond. So normally after they've completed their post-graduation, they are actually given a GR of preference of which place they would like to do their postgraduate bond in. But this time, no such option was given to them, and they were asked to join wherever they were. So I think the third years, the exam going batch suffered maximally because of a lot of uncertainty regarding their exams, uncertainty regarding coming back. And also there was a lot of apprehension on part of their parents, because at that time the cases in Mumbai had started rising. So a lot of parents had actually contacted us, the faculty members, and had even expressed their concerns. So that's about third year. I think the second year batch was also unique in the sense that they were actually pushed into COVID training without actually having any COVID training. So nothing was really taught to them. It was for them to make their way. Suddenly we found that our hospitals started becoming COVID wards. It almost appeared at that point in time that COVID had actually taken precedence over everything. It was like no other disease existed. There were no strokes, there were no epilepsies, there were no head traumas. It was all COVID, COVID, COVID all time. So that started, they felt lost, they felt helpless. They did not know. Well, they were just pushed into this and they were doing what they were doing. There was a lot of issues regarding in the hospital when more and more residents started turning positive. Lack of accommodation, lack of food and other amenities affected them so much that at one point in time, they did not have adequate rooms for isolation. So it so happened that all those residents at one point in time who were COVID positive were all put together in one room. There were no proper guidelines regarding how the isolation, the quarantine should be. Treatments at that time, nobody knew. We all spoke about HCQ, how it's useful. Well, you do not get HCQ, maybe you should start chloroquine. The prophylaxis, there was a lot of chaos, again, a lot of uncertainty. They felt very stressed. The long COVID hours, the inability to meet their friends, their family members, not able to go back home. All of this added to extra stress. And always at the back of the mind, especially the ones who are living in Mumbai, was that what if I became positive? And what if I accidentally landed up giving this virus to my parents or to my grandparents who are living with me? So many of them opted to stay in the hotel. So many of them voluntarily chose to live in the hostel and thereby avoiding travel. Thesis work suffered maximally. There were facilities, our psychiatric facilities all over Mumbai that stopped. I mean, we fortunately at Sion Hospital continued with our OPD services. Our IPD suffered a lot. We did have beds, but our ward unfortunately got converted into a COVID ward. And we were just given 9 beds. Whatever we had, whatever psychiatric emergencies that were going to be there, we had to really prioritize. So even which patient to be given what was another problem. We continued with our psychiatric services, our OPD, our IPD. The ECT, which is given so often and every day in Sion, the numbers drastically reduced. The anesthetists had their concerns. In the initial stages, we were not having adequate protective gear. The quality of PPE that was given to us was extremely poor. We had less of N95 masks. In fact, we were given N95 masks. We were made to sign in books. You have been given only so many masks, and this is how you need to use, and you need to recycle them. So there was a lot of fear regarding COVID, that what if I became COVID positive? And there was a lot of issues in terms of monetary compensation. There were promises that were made, promises which never got fulfilled. And especially for the second year batch, who is now the exam going batch now in this year, their thesis work suffered maximally because the number of patients that came to the OPD reduced drastically. Firstly, because of the lockdown. And so that impacted them to a significant extent. So overall, they felt that their psychiatric training, which is their main training, suffered a lot. Then came in our first years, the batch that joined in last year. Now this is the batch which has just finished their entrance and have opted to do their post graduation in psychiatry. Again, a lot of apprehension because again Mumbai was the hotspot, too many cases. So parents were also very apprehensive whether we should be actually sending our child at a place where COVID is rising. And at that point in time, everybody knew that, once you join whichever department, you are going to be deputed to do COVID duty. So we had our first years who came in and we immediately deputed them. Some of them were deputed in the medical ward. Some of them got deputed in the BKC facilities at Borivali, at Mulund, at Goregaon, at NSCI, Worli, and in the war rooms. So they really, at that stage when they should actually be learning about psychiatry skills, history taking, mental status examination, they were working like interns, monitoring the pulse, blood pressure, SpO2. And at all point in time, the fear, I continue using the word uncertainty, because that was something which most residents said that that's how they felt. The other issue also which they felt was that they felt that their interpersonal relationship with the colleagues in the other department got strained, especially in the medicine wards, wherein they felt that they were made to do more of medical work than the work which was actually they were expected to do. A lot of that accommodation again became a problem. There were seven residents at one point in time in one room, which made things very difficult for them. So I think, in a nutshell, if I have to say that the experience of the resident doctors has been a lot. They have been extremely stressed, be it their exams, be it their thesis, getting oriented to the new environment, working, missing out on, psychiatric training. Like, yes, there were a lot of webinars and online lectures. For that matter, even our department started with a postgraduate online training, so that, at no point in time do they feel that, we are losing our psychiatric basics. But having said that, because of the long COVID hours, uh, posting at various places, they were not able to even attend that. So I think somewhere down the line, that they lost out on the opportunity. I would say that some of them have actually lost out on one whole term, because all they have been doing is only COVID related work. So I think it has been very, very difficult for them. But having said that, I mean, life is always a balance of the good and bad. But they did actually have to say some positive things as well. They said, one of the things that they said is that has made them independent. They said earlier the life skills like cooking and cleaning and washing, which probably they've never done, they learned to do those things. They realized that one can survive even minimalistically. You would not need so much to really survive. When their own parents, friends, and family members turned out to be COVID positive, and when they would consult them, they were in a better position to tell them, since they have actively worked and done COVID duties, be it at Sion Hospital or at the Dome facilities, Seven Hills. They were all able to, help them. And somewhere in their small way, my residents, or all the residents, felt that they were truly frontline warriors, COVID warriors, who in some way during this global pandemic have made a difference and have made an impact for themselves.
Well said, Hina. That was great. Great experience to share with all of us, essentially because this is how the life comes. It's said that what is life? When planning something, life has planned something else for us.
Absolutely.
And this is what has been a learning experience for most of them. And I think the earlier, the phase of, clapping for them, thali bajao, was laughed at. But at one point I thought, there is someone who is really bothered taking cognizance of maybe not individual but as groups. So I think that was great presentation, Hina, and you just came so spontaneously, and it came with so much of your own heart speaking out. So that was great, and I think we'll have some questions later on about the whole learning. I would like to move to Dr. Ranjan, who is right here, right in front of me. Very handsome young man, and he's MD, DNB, MNMS, Associate Professor and HOD Department at Murshidabad Medical College and Hospital, and he's from West Bengal. And I think he looks a true bong. So I'm really, very, very happy to have someone who comes with great Rasgulla, and his interest has been addiction, sexual medicine, child and adolescent psychiatry. He has a number of publications to his name. He has received several awards and fellowships, name it, and he has got it. And is a life fellow of American Psychiatric Society, Indian Psychiatric Society, Indian Association of Private Psychiatry, and of course the geriatric psychiatry. So very, very happy, Dr. Ranjan. We have not interacted, I have not heard you. So it's a great thing. I'm looking forward to listening to you. Please.
Thank you so much for your kind and generous introduction, Dr. Rajendra Barve, sir. Very good evening to my co-speakers and all the viewers who are watching us right on in this webinar in the various social medias and YouTube platform. So this is the month February. The February month is the celebration of the love. Exactly in the midway of the February, 14 February is known as the Valentine's Day. And also we have been paid for lesser work for 3 days. So it's a shorter version of the month in the year. But let's not forget the huge contribution by the person who is known as Dr. Li Wenliang. He has been called as the whistleblower who first mentioned about this entire pandemic, and he died on the 7th February this month at the very tender age of 33 years. He's an ophthalmologist from the Yuan University of the China, and he first described that there are some cases of atypical pneumonia. It's occurring who are encountering in the Hunan market of the seafood market, as you all know, in the Wuhan city. But at that time, we all know that the view had been shared in the WeChat platform that the 7 of his colleagues has been affected. That has raised a huge uproar in the government of the Republic of China. But later, we all know that despite being the whistleblower, we actually got many things to learn from him. And he himself stayed in a hotel, isolated himself when he encountered the COVID. As the days progresses, the days are very important. I can remember the particular date, the 30th January 2020. On that day, 3 things have happened. First, it's been declared by the WHO as the public health emergency of the international concern. On the very same day, the first cases of the COVID has been detected in India. The 3% in the Kerala has been tested positive. On the same day, I was returning from an international flight, and I was first time tried with the N95 mask and having huge suffocation and feeling that my saturation is falling. And every time I have the obsessive checking of my saturation with the pulse oximeter. In the airport, I have also seen that many people are taking the paracetamol tablet just to mask if they have any fever, because otherwise they will caught you and put in the quarantine for 14 days. So today we have come across with a long run, and almost after around 15 months of our experiences, I will highlight my experience in 2 ways. First, I have attached with the cybercrime cell regarding the various infodemic news that's going on during the pandemic. And second, being a doctor and psychiatrist, I have certain roles to play. I'll share these experiences with you. So as we go through that, in the early part, there are lots of tsunami of the misinformations were going on in the various social platforms. And even before the 11th March 2020 has been declared as a pandemic, way back 1 month back, 15 February 2020, it has been declared as that the Tedros Adhanom Ghebreyesus, the WHO Secretary General, as you all know, has declared that we are not only fighting against the pandemic, we are also fighting against the tsunami of the infodemic. So this infodemic is the misinformation and unverified sources from the various aspects of the COVID-19 illnesses. And regarding it's a false information that is rapidly circulating in the social media without any proper verification. And with this, the WHO has started with the AP-WIN network, that is the WHO information network for the epidemics, that launched with the COVID-19, and the goal was to share the customized and relevant information that is only factual and truthful. So it's over there. I would like to give some examples of the infodemic that has been shared. That in an example, CNN has anticipated there's a possible lockdown in the Lombardy. Lombardy is the northern part of the Italy to prevent the pandemic. This publishing the news has raised lots of people. What they have done, they have overcrowded the trains and the airports, and they are rushing to the southern part of the Italy. Another example is about the health communication in the Nigeria, and also there are some unreported and unconfirmed sources that a father with 3 of his kids has committed suicide by possible positivity of the COVID testing. So there are infodemia is going on, and the ministerial role has to be taken. There are various search engines. In fact, Google has rectified its search engine, and whenever you have searched with anything about the COVID-19, they have given only the authenticated sources and versions. So there are some intervention that we have taken in consultation with our cybercrime cell. Being a frontline health worker, we should be equipped with the most research findings, because lots of research workers have been circulated in the various groups and unauthorized sources without any scientifically based evidences. Secondly, the mass media, community organizations, support groups, and civil society has to play an important critical roles in disseminating the authenticated information. All hoax messages and rumors should be removed from the all online platform that we have done, and the online portals and persons involved in the production or propagation with such misinformation should be dealt with the appropriate law. So this intervention we have taken. Now coming to the second part of my experiences, that is being the doctor in general and psychiatrist in particular. So at the very early time, I can recall in the Hindustan Times on the 3rd April, a news published on 3rd April 2020 that the psychiatrist to counsel those hit by the lockdown. So at that time, I was the Honorary State Secretary of the IPS West Bengal State Branch, and we have started our helpline. And I'm very thankful to the psychiatrists of West Bengal who participated in this helpline and we have reached many people this time. And that project was known as Telemind project. So after being a psychiatrist, I'm also the HOD of a tertiary medical college in Government of West Bengal. So I have many roles to play. First, we have done the routine OPD and inpatient care that remains uninterrupted. Secondly, we have done the training to the fellow colleagues and nursing staffs and other healthcare staffs that is known as the PFA, that is the psychological first aid we have provided to them. Third, that we also provided the psychological first aid to the person in the quarantine centers and in the isolation wards. Also provided the PFA to the family members and their relatives. We are busy in managing the primary psychiatric disorders. We are also busy in managing the new psychiatric illness that was coming in this time: brief psychotic disorder, anxiety disorder, acute stress disorder, so on and so forth, emergence of the new OCD cases. Managing relapses and the recurrences, we have to monitor the adverse drug reaction and the treatment emergent adverse events. And we have started, thanks to the unique thing has been done during the COVID. The only positive aspect that we have get in this the entire COVID pandemic period is the telemedicine practice guideline that has been promulgated in the 25th March, we all know, and has been gazetted on the 11th May 2020. So in-person telemedicine consultation was going on. All our colleagues and supporting staff were busy. In fact, the trains busy in carrying all the migrant laborers. We have extended their support in counseling, and also in the railway station, in the airports, we have done this helpline. We have trained our fellow colleagues and nursing staffs about the various stress, and we know that there's a stress and other anxiety group of disorders are on rise during this period. We have to convert our entire hospital in a SARI ward and the COVID ward. And during their stay, most of the people, those having the hypoxia, and people are getting very worried about the happy hypoxia period. So we have to counsel them to curb them their anxiety. We have also done some research work during this period. The first published in our, we have published a paper in the Indian Journal of Psychiatry mentioning the attitude, practice, and behavior and the mental health impact of COVID-19 on doctors. We have surveyed in the WhatsApp group, we have included the 152 doctors. The significant finding is that we have applied the DASH scale, DASS, that is the depression, anxiety, stress scale. This is a 21-item scale with the 7 items from depression, 7 from the anxiety, and 7 from the stress. We have found that the 34% of the doctors who have been interviewed are suffering from the meeting the criteria of the depression, anxiety 32%, and the stress 31%. This is very significant. We have also significant finding is that 85% of the doctors are feeling extremely proud to be the frontline warrior, but 69% of the people are getting very shameful that many of them are not very welcome in their respective residential places by the neighbors. That's a very worrisome thing. So we have to handle the stresses, and we cared about the physical well-being. We advised our doctor colleagues to and also our patients to eat right, stay hydrated. Also, taking care of the physical well-being for staying active and sleeping well. We have also taken care of the social well-being, and we encourage our colleagues and our patients to nurture their own relationships. We also ask our colleagues to connect with their friends and families and experience of joy of giving instead of joy of getting. We also taken care of the psychological well-being of taking the charges of the external condition that is beyond your control at that point of time, but building up the personal growth, using time to receive and strengthen the hobbies, spending quality time with the family members and the friends, acquiring new learning skills. Also being the savior of the feeling as a frontline warrior, feeling proud and just encourage and patting themselves and be grateful. We often take things that life are taken for the granted. We have learned that the pandemic that we have thrown serious challenges, and we have found that the many things we require from our life, we have huge expectation. We can live with too little things that has been restricted, and we have rediscovered our relationship with our family and friends during the entire pandemic period. So there are mental health conditions and consideration in the COVID-19 is that the people who are affected with the COVID-19 have nothing done wrong, and they deserve their respect and support and compassion with kindness. We do not refer to people as the COVID-19 cases. It's a stigmatizing time. We'll encourage them call as the people who have COVID-19. We should minimize the watching, the reading and listening to the various infodemic news. Protect oneself and supports others, and share the various stories of their hard work and how the people have recovered, how they have stayed in the isolation and the quarantine period, and honors the carer. So my first take-home message in this webinar is that it's only tough time that brings one's to in herself outside during the COVID pandemic. There are lots of uncertainties, as Dr. Hina has pointed out, is surrounding all of us right now. It was not only the coronavirus that is highly contagious, the infodemic, the shame, the fear, the threat, the misinformation, and the worst apprehensions of the people that is more contagious. Stop doubt, cynicism, pessimism, shaming, fault finding, and the blaming others. Rise above the religions, rise above the national, rise above the political, and rise above the social differences amongst us, and try to be a role model, leader, everyone in our vicinity. And it is a high time to accept more and discriminate less. Thank you very much. Over to the chairperson, sir.
Thank you very much, sir. That was really fascinating to listen to you, because it really has, that intellectual insight about what was happening around, what was our role as a doctor, as a psychiatrist. And I think we did play a role model of, what Dr. Hina talked about is the leadership is one which can sustain uncertainty for uncertain period of time. So only leaders are the ones who can contain themselves. So living in most uncertain times for uncertain length of time, what has done to us is fascinating. And I think the community and the society should be really proud that we have people like Dr. Ranjan with us who have gone beyond, you just talked about the role as a doctor, as a psychiatrist, but we have gone beyond that and we have just responded as human beings. And I think that's a great thing that is brought out from this, the pandemic. And we have seen in Mumbai, this happens during the 26th July deluge. I remember people were just, I was walking down miles and miles, people were out there offering tea, biscuits, please, baitho, khao, pio, aram se ghar jao. That kind of, anyone was offering mobile phones. So I think we retain that kind of community feeling all throughout the time, will be a great place to live with. And with that very personal experience is shared, I think we'll shift to Dr. Praveen Kumar, whom I had interacted yesterday. He's in West Bengal, but he's actually coming from Gulbarga, which is closer to Mumbai, closer to Maharashtra. Yeah. South of Maharashtra. So, and his experience has been, and he loves to be with children and adolescents. And he's taking this challenge to work in pandemic with children and adolescents. And he has got many accolades, but I think I would like to spend more time listening to him rather than talking about him. So please, Dr. Ranjan, Dr. Praveen, please take over.
Thank you, sir. First of all, I would like to say thank you to all of my co-speakers. And I would also like to thank ICON for giving us this platform to share our experiences of working with in a different field during this COVID time. So as you all know that during this pandemic, in contrast to others, children are also equally affected. And the presentation in children is compared slightly different from the way adults present with anxiety symptoms. So if you see that this lockdown experience, online learning, staying with the parents all the time, staying with a family member who is suffering from COVID, fear of family member contracting the COVID, death of a family member, parental job loss, marital discord among the parents, increased workload given during the online learning, appearing for online exams. So uncertainty about exams, uncertainty about futures, isolation from peers, loneliness, this has definitely affected our young emotional lives. So some children cope well during this pandemic, or still coping well. Some children presented with different manifestations. So some, like during this pandemic, we got some of the children and adolescents presenting with different dissociative and somatoform symptoms. So whenever a child comes with dissociative, we try to look for the stressor. And the stressor during this specific pandemic time it was the online learning that was significantly coming through in a lot of children. And it was the common cause of conflict between the parent and children, because children were not willing to sit for online classes. And initially online classes where it's more than 6 to 8 hours per day, and they had to sit at morning itself. So it was very difficult for them. So that created a lot of difficulties, and so that's when some children presented with dissociative and somatoform symptoms. And another common stressor was the marital discord among the parents. So these two stressors were consistently reported by most of the children during this pandemic time. And we also did one small survey on adolescents about how their experience of lockdown and pandemic. And out of that, like in survey, 60% of adolescents said that they don't like online learning classes. And they said that they are finding it difficulty to understand the concept. They are not able to express their doubts, so it becomes difficult to focus in the online class. And sometimes even what happened is some of the outside students entered into the online platform and threatened and used abusive words. So all such incidences happened during the online classes. So the adolescents were having a lot of attention issues. They were getting irritable. They were getting frustrated. So typically we asked one question: can you describe one word experience about your lockdown? So they were saying it's a depressing, it's a frustrating. So these were the terms which were used by adolescents. So, and another one common issue we saw is like a lot of externalizing behavior issues, like more of aggression, irritability, adolescents. So, and partly it was due to increased smartphone use. So on an average, during the pandemic times, the most of the adolescents used the screen time was more than 3 to 6 hours. And in some adolescents, it was more than 6 to 9 hours. So there was a significant addiction issues with respect to especially the smartphone during the pandemic time. So when we come to developmental aspects, so especially children with neurodevelopmental disorders like autism, ID, they were they were okay for a period of 1 month, 2 months. After that, we started seeing a sudden surge in behavioral issues in children with ASD, because there was a disruption in their routine. And all ASD children, they expect a routine. So when there is a disruption in routine, lack of stimulation, because they were not attending any therapy centers, and now the parents have to adopt the role of a therapist, role of a family member. And when they are working from the home, so that's an additional stress. So it was sometimes that stress was displacing on the children. So the conflicts were going up. So a lot of children with ASD, they started getting aggressive, irritable during this time. And we also noticed that there were some reports of regression in children. So especially around 2 years, some of the professional colleagues I've seen, they were doing well, speaking well around the age of 2 years. Suddenly they stopped speaking, they stopped responding to name call. So although we have genetic cause for autism, but definitely environmental factors like sudden lack of language stimulation, lack of social stimulation might have some role in regression. So that we need to look in long run. So, and also another one case I would just like to highlight our experience. So COVID itself has its own neuropsychiatric manifestation in children and adolescents. Research says that they might develop organic psychosis, depression, PTSD, delirium. So we had a case where a 14-year-old presented with, she developed COVID. She was in isolation for a period of 10 days. Then after that, she developed COVID myocarditis. So after that, then she recovered, she developed some depressive symptoms. Again, she went into almost like a stupor state. She was not speaking, she was not able to walk, and totally she was mute, and she was not taking food. So we discussed with neurologist in board meeting, we suspected, so it was COVID encephalopathy. So she was started on IVIG along with some fluoxetine from our side. She improved drastically after a month. So these were some of the, so we were confused. So is it just a COVID encephalopathy, or it's a catatonic presentation in psychiatry? So that was the very, very difficult to distinguish at that time. So these were some of the presentations which we got during this pandemic. And to some experiences where like the teleconsultations with children, it was a completely a different experience. So like children generally, they interviewing the children online, so it was a big difficult experience. So apparently we used to bring the toys and just uh, so we used to just it was difficult to engage them online. So and also we did some online group sessions, tele group sessions for adolescents to just keep in touch, so that like that might help them in a this one. So as we all know that, so a lot of surveys are conducted throughout the world, in Netherlands, Italy, China, so which showed that maybe 20 to 30% of children and adolescents develop some form of anxiety, depressive or stress related symptom. And what they found is, especially children with a family member having COVID-19 or a friend having COVID-19 are at risk. Children with a media exposure to COVID news more than 3 hours, sir was telling about infodemic, they were at risk for more depression and anxiety. And children with a poor social support, and children and adolescents with a pre-existent mental health condition, those who were already having depression, already having some kind of mental illness, they were at more risk for depression and anxiety. So one protective factor they found is those children and adolescents who were aware about preventive measures at less risk for depression and anxiety. So that's what they found. So these were some of the researches they have done during this pandemic. So in a nutshell, if you want to go about when we talk to parents, so parenting has become a very difficult during this pandemic. So I used to tell all parents that one best thing during this pandemic is, let's not be too perfectionist. Let's be lenient, flexible. So don't expect the same child, okay, now you have to finish this in this time only. Online learning means you have to attend. So we were repeatedly giving sometimes counseling parents, saying that let's not put too much pressure on online education. And even we discussed sometimes with the school people, and also I gave sometimes the letters to school saying that maybe they can be given some accommodations with respect to online learning, because that was putting the pressure. So like parents, as I said, like they need to be a role model for the children. Like parents being able to control their own emotions itself is a therapeutic for children. So so we also told parents to involve children in a lot of extracurricular activities, keeping them engaged. So that's a very important. So as we adults, we know that we are engaged with a lot of webinar activities. So that's how we are getting distracted. So during the pandemic time, during the stressful adverse time, so it was found that the more you are distracted with, or more you are keeping yourself busy, so somehow you are coping well. So with respect to children, they need to be engaged with a lot of exercise, indoor play activities, so a lot of June social activities with their kids. So that might help children. So these are the certain things we discussed with parents. So to add up our last point, which I would like to say, so the research has shown that during the adverse time, what is the one factor which is very important is resilience. So that is there amongst all of us. And what is one factor which will determine resilience is self-compassion. Let's be compassionate towards ourselves first. This is a tough time. We cannot expect ourselves to perform 100% better during this. It's okay, fine. So this is the tough time. So let's be compassionate towards ourselves. Let's be compassionate towards our children, and let's be compassionate towards our colleagues. That's the way to go ahead. So this is what I felt this one. Thank you, sir.
So beautifully presented, Dr. Praveen. It was like visiting homes and being with families and actually feeling the pulse of the parents. I remember I have a grandson who is 4 years old, and he visited us after a long time. And every time he comes and he just hugs me. But this time he came wearing a mask, and I thought he's going to jump on me, but he kept his distance.
Yeah.
And he smiled, removing the mask, and said, "No, social distance." So it was like, it was like a great revelation that the children are real wonderful teachers.
Yeah.
And it just, I was in tears when I heard all this. So it was like, the families coming together, like we have seen the Discord, but I've seen some families, vibing so well, loving each other, accepting all their problems. I had a couple therapy during this time, and they were fighting, and they said, now is the time for you to sit and talk sense to each other and stop playing the blame game, because there is something else which can blame very easily. So let's not blame each other. So I think it had brought some sense to people, and it's such a great insight that we have got about our own families with which we are living. And the telemedicine, of course, was very, very interesting. And I think shifting from that, we have Dr. Rahul here, who would like to speak about, and I must say, give credit to Rahul, because we had a long chat some time back, maybe about 8 months back. And I said, I'm feeling very lazy now. I don't feel like working. And Dr. Rahul said, no, you have to go back to work and do it. So I think he gave me that inspiration. And that's why he's a most promising psychiatrist in South Mumbai. He has been awarded that. He is also running a Schizophrenia Association and is involved in the rural mental health awareness. By the way, I had a very interesting experience when I had conducted so many webinars, and some of at least 3 webinars I had with farmers from remote areas in Maharashtra, Yavatmal, which are very famous for their suicide, and Marathwada were very small time worker farmers. It was very heartening. And I realized that I didn't want to talk to them about psychiatry. I just read, the Abhanga and Shlok from the saint poets in Maharashtra. And it was like a very, very touching moment for them that, who is providing us insight, who is providing us courage, are our own stalwart poets. And they are telling us how to live life. And now is the time for us to put all ideas into practice. So I think let's hear Dr. Rahul, what he wants to say. Please, Dr. Rahul. Is he around? I saw he's left or something.
So it looks like he's facing problem with the internet connectivity.
The internet, is it?
Yes,
okay.
Yes, sir. Yeah.
So shall we wait, or we can shift to Dr. Ruksheda and then maybe...
So that would be better. That would be better.
Yeah. Dr. Ruksheda, of course, she's a very good friend of mine. And I always see her smiling. And one thing that I learned about you today is that don't say I'm the same, I've become prettier. And I must say that to you, Dr. Ruksheda. Every time I see you, you have such a wonderful sense of drapery, the way you dress up. And I think she has done wonderful work, particularly in women's mental health. So I was very curious about her experience. And she's a co-chair of Women's Mental Health Speciality section of the Indian Psychiatric Society, and is also an executive council member of Indian Association of Private Psychiatry and National General Secretary of Indian Association of Biological Psychiatry. So we have a very, very interesting lady here who is very vocal about how she feels about women in psychiatry and women patients in psychiatry. So over to you, Dr. Ruksheda. I think you need to unmute yourself.
Yeah. Thank you so much, sir, for that rather sweet and I shall also say pointed introduction. I'm not sure what Rahul was going to contribute to the conversation because, when we were discussing who's going to say what, I was like, okay, you guys are like doing fantastic and all of you guys are covering such vast topics. I'll just come in, just fill in the blanks because I don't think I have that much more to add to all the great and amazing insights that my colleagues and friends from across India are sharing. I think me, just like all of us here, we've shifted gears a little bit, isn't it? What our usual clinical work was, that's definitely shifted. But because of the pandemic, since especially in the lockdown, I think we've done a whole lot of other things as well. One of the very positive impacts about the pandemic is that from day one, because it came from, whether it came from China or whether it came from the Western world, it was that initially there was always talk about how mental health is also going to be impacted severely, and which we've seen, isn't it? 100% of the entire population on this earth has been impacted by COVID one way or the other. Who do we know that doesn't know somebody who's died of COVID? I think all of us know someone. whether it's a friend of a friend or a neighbor or a distant relative or a close loved one. So just by the sheer amount of loss that all of us have suffered, it's kind of equalized us, right? And this Monday was rather a difficult time for me because initially when the pandemic happened, the lockdown happened, my affordable care OPD shut down. First couple of months I was very, very agitated, and how are my patients going to cope? What are they going to do? They don't have access, and a lot of them are not going to be able to see me online, and all of that. And eventually, of course, you desensitize yourself a little bit, or put in your clinical distance. And when now that the OPDs have restarted and the word is spreading that okay, the subsidized OPD, the affordable care is open, they're following up, dhire dhire. But it kind of makes you keep wondering, how many patients did I lose to death by COVID? How many patients did I lose because they had to migrate or change because of the financial aspects of it and those challenges? How many patients of mine have lost loved ones? Because, when you see a patient, you also see their family or a loved one and a caregiver, isn't it? So when you see, that's what happened on Monday. A lady walked in, her husband died and her son died, and she's all alone all of a sudden, and she's never lived alone in her entire life, and now she doesn't know how to cope. And then there are financial implications along with it, isn't it? So the changes of the pandemic, whether that's directly, indirectly, whether that was initial phase of the pandemic, in the middle, or towards the end or the second wave, we're going to see these kind of impacts for a long time to come. And it kind of reminded me that, okay, I need to take a step back occasionally. I need to debrief myself occasionally, because I am going to confess, and I speak about it quite openly. In between, around October, September, October, I was like, I'm going to hit burnout. I'm going to hit burnout. I'm going to hit burnout. And every time I just kind of held myself and okay, let's try this for this week. Let's try this for that week. So it was rather challenging for all of us also, isn't it? Different people have been doing different things, just like how we heard from Ranjan, who was doing so many amazing work. I know, one of the first things we did was volunteer for online help. I still have people from 1 year ago who had first contacted us via online. In fact, recently, that's what I even shared on my social media. I got a very cute little, doodle from this 19-year-old, a person who had first contacted me via the helpline, just in the middle of exam preparations, doodling, so sent across to me. So those are the perks also, and those are the positive impacts also. But having said that, taking the time off to debrief ourselves is also so important. And thankfully, it's, I've managed overall to take care of myself, reached out to people, friends called up to check on me without getting mad that why am I calling to check up on you, and why are you never calling to check up on me? But having to deal with things like one of your best friends losing both the parents in a span of 1 week, and you can't even go and speak to her or just hug her. So there are a lot of challenges personally as well and professionally as well. This year has been, we've lost the maximum number of psychiatrists to death, isn't it? They've all traveled across to heaven, and I don't think we've had as many kind of condolence meetings as that we've had in the past. It's unprecedented. So those are again griefs and losses that we are kind of encountering. Some of it we're managing, some of it we are finding it rather challenging. Another really interesting thing that, I'll share in the middle of the pandemic, I had this one person, the wife is a patient of mine. She gave me a call saying that, okay, there's my husband, he was COVID positive, he recovered, now he's back home and in isolation at home, but he's showing these kind of behavior disturbances and everything. So of course I got online, spoke to him, figured out this was, COVID related psychiatric illness, and started the treatment and everything. He got better, and when he got better, he came and shared that he was very thankful to the MD physician who took care of him and got him out of the infection and all of that. And he said that, oh, my doctor was very clear from day one, told me everything. He told me how the illness and the treatment of the illness could elevate my blood sugars. So I was constantly praying, God, don't give me diabetes. But he should have told me that there is also a possibility of a psychiatric illness, I would have prayed for not that also, and I would not have got a psychiatric illness. So again, that is something that kind of like very often gets overlooked. And I know I have so many, there's so many case histories and shared learnings from other psychiatrists that a lot of first, there was no fever, there was no breathlessness, there was saturation was fine, but the first symptoms of COVID was that, okay, there was a psychiatric illness, isn't it? So we understand that. And of course, we psychiatrists understand how mental health and cognitive abilities and all of that is interlinked with the immune system, isn't it? But there is a renewed interest now that antidepressants have an immunity booster kind of a mechanism of action as well. So there's a little bit now, more chatter about it. So there's a lot of learnings from that, from a biological and point of view as well. We also know that how we understand how the pandemic has made us more vulnerable to psychiatric illness and to other chronic illnesses because of epigenetics. We talk about it a little bit more. I think that's also improved the spread and the awareness of mental health. Of course, when that comes in, also a lot of quacks come in. So that's another battle at another hand, right? Isn't it? So we do want to make sure that, okay, we're spreading the right information. And I think the media has been pretty good about that also in terms of sorting out who's the right person to approach for accurate information about COVID or about mental health. I know I've contributed quite a lot to the media as far as my other passion projects are concerned. So we had once a month support group for young adults. And because of the COVID, thankfully, we went online. And because of that, we could reach out to young people from 18 to 30 years of age all across India. So a lot of them join in every month. Now, we meet online, and it's a free group. We pick up different topics to talk about. So again, there's been a lot of positives along with the negatives. There's a lot of information and there's a lot of learning, but just like the pandemic isn't over yet, the same way the after effects of it isn't over yet. And there's still a lot we don't know, but we are optimistic about it, that it's going to be okay and we're going to be okay. And a lot of positives that we've learned during the pandemic, we're going to continue and add it in a sustainable manner in our lifestyles. So many of my colleagues that I know have a better life-work balance. I know for a fact that I'm not going to stop my telepsychiatry. I mean, I used to do telepsychiatry even before pandemic, but of course, during the pandemic, it initially became 100% telepsychiatry. Now it's gotten back to kind of like 50% of it, and I'm going to stick with it. I'm not going to do in person every single day, just because I also want to lead by example. That, I was just speaking to my neighbor earlier, and I was telling her that, what, your parents are older, I will see them online. You've already told me everything that you need to. Don't tell them to come here, even though we are taking care of the safety and everything. But because with the elderly, again, a lot of it is that we are dropping a lot of balls there. We're not keeping in, even now, we're not up keeping with the regular doctor's visits, regular blood tests, regular checkups and physical checkups. And that kind of neglect is something that we are seeing. And that's one aspect of it. And the other aspect of the positives as far as women are concerned, that initially in the lockdown days, there was a surprising increase in number of men now contributing to household activities, chores, responsibilities. And there was a better learning and insight amongst the men that, okay, this is what needs to be done. Having said that, the amount of increase of physical, social, emotional labor that the women have gone through is still very unequal. So though there has been a spike in change and shift, or even at least understanding of gender roles in the men, unfortunately, there's been a significant amount of rise of stress related to extra burden of child care, home care, and work care. A lot of women have stopped, they've again given up work, they've gone out of the workforce, especially the white collar jobs. And initially the trend that we did see, a lot of contribution from the men. Now that towards the fag end of the lockdown and the pandemic, it's kind of reversed all over again. And So there is no kind of respite there. So hopefully those gender roles reversal, or at least understanding, there would be more equality. I know we're running out of time, and I hope that Rahul's joined us back to kind of share some insights from his end. But there's so much that I want to share and contribute that the time's never enough, isn't it? But it's been really interesting to meet everybody online once again and learn from them. And thank you so much, Dr. Barve, for giving me the opportunity to speak as well.
It was great. I just recall, because I've been doing telepsychiatry and had several calls from people who are from US and UK. And I remember one call which came and the person, he had been counseled, he had gone through treatment, he was taking antidepressants. I said, you seem to be pretty well covered with the psychiatric aspects, mental health aspects. So why do you want to speak to me now? To which he said, no, I just want to cry. And I want to cry in Marathi. Actually, there's no crying in any particular language. But to say that I want to cry in a particular language, because that's what connects me to you. And it was a very touching moment for him. And then he literally cried for about 5 minutes. I said, now are you happy that you cried in Marathi? He said, yes, okay. So now I'm at peace with myself, because I had this touch, which is so very important. And because I spoke, he was living alone. And that was the reason. And I remember one Indian lady who had lost her son in US. And she could never go, never visit. And she just saw me in market. She just looked at me and said, you are Dr. Barve, you are a psychiatrist. She almost hugged me and she said, there's no way I can express my sadness, because I have not been able to see my dead son also. I mean, very, very touching moments that we have seen. In my own building, we lost 2 people. So it was very, very difficult moment. And let me be very frank, I was on fluoxetine for a while, because that was the only way I could carry on. I said, who is the person who is going to respond, who's going to take this positive action? Is myself. So let me start with fluoxetine. And I was on 40 milligrams for a while, 20 milligrams. Now it's once a week or twice a week only. But I'm very happy. It is like, my experience has been what it is like to be on the other side of the table. The anxiety, the panic, the ruminations, the fear, everything that the patient described is like I've experienced in this life within myself. So that was a great thing that happened within me. And I think, as very rightly said by Dr. Ranjan, Dr. Praveen, and also Dr. Ranjan, is about this self-compassion. That compassion that I'm with myself. I'm with myself. And that I love myself despite everything. So that was a great experience. I don't know whether Dr. Rahul is around.
Yes, sir, he is, sir.
Okay, please carry on. Dr. Rahul, I've already introduced you. You are the nominated Youngest Health Achiever Award in South Mumbai. So please welcome Dr. Rahul.
Good evening, everybody. We have gathered here to discuss something casual things, our experiences, our learning during pandemic. Yes, pandemic has given us different life now. We used to traditional consultation, like sitting with the patient, consulting the patient. And now we are switching over to online consultation, which is, we all know about it. Like there are many platforms we have for the online consultations. We can consult patient, we can manage appointments, everything, blah, 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 blah. So I don't want to go into detail of that. I want to tell you something, some tidbits about online consultations. My team is very enthusiastic. We have started online counseling sessions, abroad patients, like overseas patients. We are already dealing with some patients from UAE and other countries. So we have started that facility again. We are counseling patients, at least 4-5 patients per day overseas. And my team is very, very enjoying this. So that is a very much, I'm getting benefit out of that. Of course, monetary and satisfaction, I'm getting satisfaction out of that. Second thing is what? Webinars. Yes. I'm using this webinar. See, we people always say we are flooded with webinars. We hate webinars. But why to hate webinars? We are not bouncing on you. We are not forcing on you that join this webinar. Yes, but I would suggest you to join webinar of your choice. Join it, attend it, and enjoy it. It's like a stress buster for you. So that way, I'm using this webinar to for my activities like awareness activities, which I used to do before lockdown. So I'm reaching out to the people, reaching out to general people through some NGOs, through some associations, through some corporates, so that I can make them aware of anxiety, which is very so much prevailing now because of anxiety, because of this pandemic. People are very anxious. So what to do in that case? So we are creating awareness through webinars. And those webinars are really useful for the patients, for the people, for the general population to understand what is psychiatry. So if you are really not practicing this webinar for awareness activity, please start doing that. That is really going to be helpful. Third thing, very important, like whenever a patient comes to us, at least when patient comes to me, on day one, after proper diagnosis, proper history, proper diagnosis, proper starting medicines, I always tell my patient to follow some sort of exercise, either physical exercise, yoga, or pranayama. And you know, my friends, our patients are the dedicated listeners, a very dedicated, sweet listeners. They don't follow it, but so what my team thought, why not we do something for them? Since it is pandemic going on, we are locked inside, so we'll do something online thing that will be helpful to our patient. So then I formed a group, that is meditation group, and I sent invite to all my patients. Then I thought, why patients? I'll share it with some other people like my friends, my family friends, my acquaintances, pharma people, and now I got 450 people following my meditation group. And we every day morning I send an audio clip which they have to listen to that audio clip and do meditate. So this way, along with meditation audio, I always send my quotes to motivate them. How can they overcome their anxiety? How can they overcome their depression or any mental agony? That is useful for them now. So I'm getting calls from my clients, those people who are members of the group, that they could overcome that anxiety feeling because of doing meditation every day. Because this group I started in month of June 2020. So they have been doing it since last 6-7 months, and they are very happy doing it. They are really enjoying it, and they have passed my number to other people so that they also can join it. So this way meditation group is really helpful for those people. Third is very this thing, the very innovative idea is what, doing something entertaining for the patient, for people around us. So my team has come up with one musician. We have got that musician in our group now, and we are going to have that music therapy online, where that musician will play some songs for my patient will they will request some songs, and also that way we are going to have antakshari or music therapy for my patients. If anybody wants to join, again, like apart from the patient, they are also welcome for that group. And yoga, yes, that is left out. Yoga, always tell my patient to follow pranayam. And I don't know about you all people, if you do really pranayam religiously, you can overcome your stress very easily. You get that motivation to overcome your stress, to get that confidence, that optimism. So I always ask my patients to follow pranayam, to observe pranayam, and that way, again, they are not doing it, they are just sweet listeners. So again, I got one person who is a yoga trainer. I involved him in my group, and we are doing online sessions for yoga training, pranayam training under the banner of Fit Yatri. So that way, we are really going to all, reaching out to the people to tell them how we can manage your stress during this pandemic. So my dear friends, this way, pandemic is not something, of course, it has created anxiety, but I have learned something out of this pandemic in this way. And again, one more thing I learned, currently learning, that is content writing. Yes, we have to mark our presence on internet. We have to optimize our SEO. So we have to write some content, good content. Example, like currently I'm writing of internet addiction. So that way, writing blogs, we can come up, we can optimize SEO. So if you really want to learn something, start learning content writing. I've done one course, that is a tobacco de-addiction course. And now very soon I'm going to have my OPD dedicated to only tobacco de-addiction. One day, once a week, I am going to start that tobacco de-addiction OPD. So this way, lockdown is locked externally. We are locked externally, but internally we are unlocked to know ourselves, to know our potential, to learn something. And that's all, my dear friends.
Great. That was very nice. And Dr. Rahul, I have not joined your yoga group, but last 10 months, I'm doing yoga very, very regularly. Apart from the fluoxetine, what has helped me is about 20 minutes of pranayam. And I got my 6 packs, which is gently covered with fat, but it is there inside me. I lost about 6 kg. So I'm making use of the time. It was great. I think we can open it to the participants.
Dr. Barve, I want to add something to it. About meditation and pranayam, you are my motivator actually. I learned all those things. You keep sharing your post personally on my WhatsApp group. So I learned from you that meditation is really important. I learned it 5 years ago when we had met for the first time over coffee. And you told me about your Tibetan and everything. So my friends, he's actually meditation guru for me, for us.
Okay.
Yes, sir.
Okay. Thank you very much. Of course, the credit goes to my teacher. He's in Sri Lanka. He said, and I would like to say a few things about, since you talked about self-compassion. Ultimately, the tough times don't last. Tough people do last, and everybody has got its own time. One of the very important parama or the great learnings of Buddha is the 4 things which are called Brahma Vihara. The Brahma Vihara is real panacea for all psychological illnesses, I believe. One thing is that what was said earlier was compassion. Karuna, Metta, Mudita, Upekha. These are the 4 things which have been said by Buddha. Karuna is compassion for self and people. Metta is very beautiful because I think what I heard today is that the barrier between patient and doctor is breaking to some extent. And we are coming at the same level. That's the real metta feeling. The feeling of friendship, being on the same page with the patient and just relating with them as a human being. Then there is upeksha, being able to look at the ups and downs of life with detachment. And lastly, we shared with all of you is this mudita, is the experience of happiness which comes from seeing other people recovering, seeing other people being happy, which is a real challenge because jealousy creeps in, everything, envy creeps in, and instead of that, if the mudita creeps in, we become happy. So the 4 Brahma Vihara Sutra are very important, laid down by Buddha 2,600 years back. And I just wanted to say that to all of you. Now we have little time for, it's already, we have exceeded about by 60 minutes anyway, but I think we'll take a few questions from the audience. I think Meena will be able to give us the story as to what questions people want to ask.
Sir, we have got a few questions.
Yes, please.
I'll just read it out. Yes.
Yeah.
Because there is no one who has raised his hand to interact personally. Okay. There are questions which have come in. I'll read it out. Okay. So I'll start with the first question. That is, how has lockdown affected the mental health of the resident doctor? I think it is directed towards Dr. Hina. Her topic was on the residents, impact of COVID on residents. Ma'am, if you can.
So I think, like I already mentioned in my talk, yes, it has been a stressful time. We've had residents who have had depressive symptoms, residents who themselves have faced a lot of anxiety problems, especially the fear not for themselves that, they might become COVID positive, but most of the times it was the fear of, taking that virus home, giving it to your parents, to your spouse, to your grandparents. So all those issues, monetary issues, because at one point in time, especially for our in-service candidates, because, the clerical staff had also reduced. The number was cut down. So, their paperwork for their salary, their effectives are not was sent. So besides the other psychological issues that they faced, they did face some monetary issues as well. So overall, it has been a very difficult time for them, put into this COVID fight, without actually any ammunition. It is now that, over these couple of months that, we have really understood how the virus is, what are the probable treatments, what is something that is going to help. But at the start of it, there was a lot of chaos, there was a lot of uncertainty, lack of having proper PPE kits, N95. or sanitizers. There was a time when we had absolutely no sanitizers. We were recycling our masks and all that. So I think it has been very, very difficult for us who have been working in a government setup. We unfortunately did not have the luxury of doing telepsychiatry, telemedicine, sitting at home. So we were there every day seeing patients, or not just psychiatry patients, but also patients, from the other departments, COVID patients. At my hospital at Sion, we actually also run every Thursday afternoon at 2 p.m. a post-COVID care OPD. So all the patients who have recovered from COVID. So it is more of trying to help them if they have any psychological, any medical, any chest-related issues, like physiotherapy. So we've actually have this whole multidisciplinary team which actually caters to all these patients who have suffered COVID in the past. So overall it has been stressful, but I would say that earlier what started off as adjustment has probably over a period of time has now become, we have adapted. I think in the beginning, as what Dr. Barve said, that yes, we are approaching, this is probably going to be there with us, these this new normal, or this phenomenon that is going to there is probably not going to leave us so soon. But I think, having said that and all, I think the residents are probably right now in much better space than what it was when they started at the beginning of the pandemic. So yes, I think overall, I think yes, it did take a toll on their mental health. But now I think, as they have been gradually weaned off, and with the ease in lockdown, and with transport and other things made available, and that they are back to again with us doing psychiatry, seeing psychiatry patients, and now that lectures and clinics and everything has started physically. Like just yesterday, I gave a talk to 200 MBBS students first year who have joined in as a part of their foundation course. So I think yes, I think I won't say that they are 100% happy, because I'm sure they have their own grievances, maybe grievances against us as seniors, the bureaucrats, the higher ups and everything. But having said that, I do see that what started off earlier, I would definitely say that they are adapting to this new normal.
On that note, during the pandemic and all of this, and whatever Hina has just been describing and everything, a lot of residents were reaching out even to us who are in private practice, because somewhere they couldn't feel they didn't feel that they could reach out to people in the campus, and they probably didn't want to reach out and on people on campus, because everybody was in the same soup, so to say. So one of the things that we did, and I must mention this here because we are so kind of grateful to people and friends who came together to do this. What we did was we did a series of Zoom meetings called Stars Meet Heroes, where we invited celebrities and we then invited our heroes, who are the real heroes, the resident doctors, just maybe some 10, 12, 13 resident doctors, one-on-one conversation with these stars. We had Shreyas Talpade, Javed Jaffrey, Johnny Liver, Arshad Barsi, Vidya Balan, Imtiaz Khan, Imtiaz Ali, we had Tushar Khan, Tushar Kapoor. We had so many great celebrities. They would tell us that, oh, I'm only going to give you like 15, 20 minutes. And I would have to shut them down after an hour, saying that, listen, you may not have a life right now, but these doctors have to go back to work. So we did something like that. We tried to do something like that, so that we wanted to show that the apathy towards the residents is definitely not there. Then the interns piped in saying that, ma'am, we are also working very hard. So we did a few intern specials as well, where Ashi Vidyarthi spoke, and Dr. Mohan Agashe. We did Nagpur special, Hyderabad special for residents from Nagpur and Hyderabad. So it was those videos are up on YouTube as well for everybody to see. But I think for me it was kind of like personal, because they are ours, isn't it? They're our residents. So we have like a sense of community, but also a sense of responsibility, and also a sense of that we want them to grow up having more empathy out of this pandemic instead of more cynicism. So I think the resilience kind of kicked in, just like Dr. Praveen also talked about, and we need to continue supporting each other and supporting our juniors and taking care of our seniors, and continue learning from all of us.
With the kind permission of the chairperson, just sharing on the experience very briefly. So we have taken the two group of resident undergraduate student, 100 undergraduate student from each year. So what we have done that we have divided into them three halves. One group we have given the lifestyle modification and the life skill coaching with the traditional relaxation exercises, deep breathing. Second group we have added the music therapy with the raga bhairava, and in the third group, in the placebo arm, we have tried with the non-neutral stimulus. So with this, we have found that after the period of 8 weeks, the before and after the therapy, significant improvement with the lifestyle modification and with music therapy. This group has scored very well, and there is a significant reduction level of the stress and anxiety. And we had also checked the performance, the internal assessment marks before and after this therapy. The group that has received the lifestyle modification with the music therapy has scored significantly well, and that is statistically significant. That's one experience I'd like to share.
Very interesting, doctor.
Thank you, ma'am. Yeah, thank you, ma'am. Thank you, Ruksheda, ma'am. And thank you, Dr. Ranjan, for contributing to this question as well. There is one more question that has come in. This is maybe partly directed towards Dr. Praveen as well. So, sir, the question is, in contrast to adults, how children are affected during the lockdown, how COVID-19 has impacted children's mental health? This is the question.
Yeah. So, like as I discussed, the children present in a different way. Like in contrast to adult, see, we got a lot of children presenting with non-specific pain. So, like I can tell you about that one child just presented with a just chest pain. He was completely evaluated, nothing was found, and when I was just interviewing him, he said, like, sir, doctor, do you think I have any hole in my chest, any hole in my heart? That was the his question. And I said, like, that boy, he was tracking the number of cases which are increasing and number of cases which are recovering. Doctor, so today, no, there is 1,200 recoveries and only 900 new cases. So children around 8 to 9 year. So and even they were I think the impact of the Sushant Singh's death, that was also very significantly, especially those who were watching, those who were following the media for many number of hours in a day. So it was having a tremendous impact. So because if you are stressed because of some other reason, be it your personal, professional, and something happens in the news, and if it's a celebrity, definitely it puts waves in your mind. So that was also impacting. So that boy apparently has seen some person getting a heart attack in the news. So after that, this boy who is already stressed because of the online learning pandemic and starts having this chest pain is there. So children generally, they don't say that I'm feeling sad, they don't say that I'm feeling anxious. The way they express is through physical symptoms. So that's how that was the one of the presentation which we were getting with the children. So, and as I said, like adolescents, it was more of a irritability and all. So the lot of work was with the parents, like how to help their kids. So with respect to, as I said, like related to online learning, let's be becoming a bit more lenient on them, and also like children, more of a distracting techniques, play therapy, like indoor games. I used to tell the parent, just involve them in life skills, more of a life skills, in a sense, like for example cooking, for example doing some home activities. Just involve them, they get pleasure, they want something to do. And if you just involve them in these type of tasks, they get distracted, and that also helps them. So it was a difficult toll on children, and now we are seeing the positive aspect, like children are getting back to the school now. I was just talking to one 10-year class 10 student who got back to the school class, and she was saying, sir, I'm feeling very good. At least I felt like hugging my friends when I went to the school, and hugging my teachers. So there are positive aspects which were happening. And she was saying, sir, sometimes although there are less students in the section, sometimes I saw like I am the only one student in my section. So during this reopening of the schools. So these are some of the experiences which children are having. So, but like what is very important is adults, as we are role models for the children. Like, so it's very important to, like, if we have a better emotional regulation, and so that will definitely improve children's emotional health.
Towards the later part of the lockdown, there's this increase in consumption of cannabis by young adults, isn't it? And I had to literally tell everybody, don't share joints, because they would be wearing masks and gloves and sanitizing, taking a shower after coming from outside, and they would forget that you're not supposed to be sharing joints, because most teenagers are not used to finishing one joint on their own, and they can't like bring it back home. So they would be actually doing it. So till now, I'm like, if you're meeting your friends, don't share a joint. So that was another kind of like interesting thing. And of course, the online porn, that increased quite a bit as well, isn't it?
Yeah.
That's a harm reduction sort of strategy. Yes. Harm reduction strategy. So in continuation with Dr. Praveen said, is in the initial part of the pandemic, it is very difficult to control our kids, because due to the Freud's oral gratification phase, they have a habit of thumb sucking and just touching habit. This sort of habits are very difficult to going against the practicing the physical distancing process. So I have advised one interesting thing to my patient. We know about the game that touch me if you can. So I have practiced the don't touch if you can. How long if you cannot touch each other, then you will get an incentive. That found to be effective to my kid patients, and they are doing well. That was one of the I'd like to share that experience.
What worked with our 5-year-old in our house is when you go out, you're supposed to put your hands in your pocket. So that kind of helped with adult people as well. And I told them, if my 5-year-old can do it, you guys can do it. So yeah, behavior modification of a different kind.
Thank you, sir. Thank you, ma'am. I'll take up 2 more questions. The first question is, what are the key mental health problems that have evolved up as we progressed with the pandemic curve?
Dr. Ranjan could take up.
Yes, sir. So during the initial phase, as we know that there is a fear phase or apprehension phase, then we process to the fear phase of learning. And then finally, we have reached the phase of accomplishment and practicing the proper guidelines. And we have come across the scientific-based, evidence-based data, and we are just following that. So initially, there is a lots of patients are coming in our clinic with the apprehensions of the, as mentioned already, by the anxiety group of disorder, acute stress disorder, panic disorder, obsessive-compulsive disorder. I have found certain cases of the brief psychotic disorder in my clinic, and I have managed them effectively. The problem was that during that period, our old patient couldn't get the treatment. They have interrupted the treatment. The severe patient who having severe mental disorder like schizophrenia, bipolar disorder, they are off medication for a longer period. That was a very challenging period for all of us. And we have to manage this, and these are the flare-up symptoms. Some interesting cases, as already mentioned by Dr. Praveen, in one of the cases that faced the delirium in a case, they have encountered whether is it due to COVID-induced or not. That has to be justified, but this case is a unique one. But in my clinical patient, I have seen the certain instances of the brief psychotic patient disorder. More patients coming with the OCD, with the hand washing and hand rubbing, using of the excessive use of the hand rubs. These are the patients that I have found. So in the last phase now, what is happening, the many patients due to the economic depression, they have lost their jobs, and migrant laborers have to work hard. We're getting the severe challenges of depression. As they mentioned, there are reported or unreported cases of the suicides. We need to go for the suicide autopsy. These are being a mental health profession is a serious challenge thrown on us to carry forward and show the light to our community.
Thank you, sir. Thank you very much for answering.
Yeah, OC patients are very quite often nowadays because of the compulsive washing, along with general anxiety disorders. Patients having a fear, if they can contract COVID, that fear is very much among the patients nowadays. And the patients who are not, did not receive proper treatment because of lockdown, they could not contact a doctor. So recurrences are very often now. And one more thing I want to tell you about after lockdown, as Ruksheda also said very nicely, correctly, that use of marijuana by young adults, weeds, that is also increased nowadays. after lockdown they got access to weeds, and now it's very much we are seeing many quite adolescent people like having weeds, use of weeds.
I think another aspect, a good insight is that those people and patients and caregivers. I can't hear Rahul. Can anybody hear Rahul?
No, ma'am, it's same for us.
Oh, poor guy. He has a bad connection.
Yeah.
Sir, we lost you
Okay.
due to poor connection.
Yeah,
Ruksheda, please carry on.
Right. So I was saying that another interesting kind of insight and learning was that those patients and caregivers who had a better level of psychoeducation, they were careful about not going off medications and treatment. Even if they couldn't get in touch with their psychiatrist, they tried to get in touch with a family physician, got a fresh prescription, and continued treatment. Because one of the things that I say that till the time you don't see me, don't stop medications. So a lot of them, I was so thankful when the follow-up started again that they didn't stop medications. Of course, there were some cases who went off, there was relapse, and especially in chronic psychiatric illnesses like schizophrenia and bipolar, but a lot of them continued taking medications. And our medications are so safe, so even if there was some amount of unsupervised medications in that sense, they have been fine and they've been able to take care of themselves. So that was really nice and hopeful.
Yes,
Yeah.
Thanks to online consultation for that.
Yeah, one experience I had because the chemists were not willing to give medicines without the prescription.
Yeah.
So I had a good contact with the chemists in areas from where patients come. A very personal call to chemists. Please honor the prescription. I know this patient for a while, and please provide medicine. I'll send you the prescription to yourself. These personal calls to the chemists were really very useful, because they could continue the treatment. From where will they get these medicines? So I think that personal touch and having good rapport with the chemist is very, very useful in all the times, but not currently very, very important.
So, sir, I'll take the last question here, and I think it's directed to all of you, because the question itself says, as a caretaker of our mental health, what will be your take-home message for the audience today?
So
Very
should I go
important
first?
that-
I started first.
Yeah,
Okay,
okay.
Yeah,
Yes,
So, well, I have been on both sides. I have been working at the front line. At the same time, I have also been a teacher. And I have seen my residents, I have seen other residents from other departments who have also come and, spoken to us about whatever difficulties they have been facing. To add to what Ruksheda said, that the program that they had done, the encounter with stars and all, I had very generously even donated some residents from Sion Hospital to, go there to have that feel good thing, when, you're speaking to a celebrity. So having said that, I think my learning is that we have learned a lot from our residents. They were unhappy, they had their problems, but I think at the end of the day, they did what they had to do. And I think over a period of time, I think everybody has got, adjusted to this. They've become more resilient. And on a personal note, I mean, I have lost a family member due to COVID, and a lot of other tragedies that did take place. Like I mentioned earlier, I was not able to sit at home, unfortunately. The nature of job I am, where I work, I did not have the benefit of opening my laptop and, sitting. So I have been there, I have done that. I have been working in an exclusive COVID hospital providing mental health services. So I think what I learned is personally is to not take anything for granted. I think life is too short and is unpredictable. So I think cherish every moment. This time, though, I know that Dr. Praveen said that they did come across a lot of cases in children where there was a lot of marital discord. But on the other hand, I will also say that, when faced with this adversity, we also felt that as a family somewhere, we got together more. So I thought that personally for me, I thought that this has been my maximum learning out of this is that, to be there in the present, to be there for my family as a wife, as a mother, as a daughter-in-law, and as a teacher in a medical college, for my students. So I think, yeah, definitely this pandemic changed. This pandemic has really been an eye opener.
Yeah, Dr. Praveen?
Yeah, sir. Like as I said, it is the first thing is, like as I said, it's more of a let's be lenient on ourselves. Let's not be too much perfectionist attitude. See, this is what generally we are being brought like this. It's one study said in Southeast Asia, children and adolescents, they are brought up from the beginning that you had to score this marks. So from there, it's from the outside there is a this tendency there. So naturally people are stressed. So, and during the pandemic you can't expect the people to do the rest. So let's be lenient. As I said, it's not as easy as I'm saying. So but the thing is, so that's the way to go ahead. And we don't know what is the long term impact of this pandemic on children. So so that's why there is a need to be keen or attuned to their emotional health, and let's work on that.
Dr. Ranjan?
Yeah, as history repeats itself, century back we have faced the gripe esponella, the famous or infamous Spanish flu.
Spanish flu.
So there are with the new normal practices that is going after this COVID pandemic, that working from home, temporary unemployment issues, the homeschooling children, the lack of physical contact and with the family members, adapting lifestyle changes, we all have to face that. So my take-home message to all the listeners and viewers here, that listen to advice and recommendation from the government and do not follow any other stray comments, and unauthorized source information should be abandoned. Have a daily routine practice as far as possible to stick to that routine practice, yoga, meditation, take a good food habit, and spend quality time with your friends and families. Minimize the news feeds and the sensational news that is broadcasted in the various medias. Social contact is extremely important. In the initial phase of the lockdown for the 42 days, we know that the selling was ban of the alcohol. But when the Pandora's box opened, we all know that what had happened actually. There is no evidence or protective effect of drinking alcohol that has been popularized as one of the infodemics. Screen time has to be restricted. Playing the video games, especially for the kids who are doing what we are doing with the online classes, they're taking a break and indulge with the video games and doing chats with their friends. And support the healthcare worker, respect them, do not speculate. Lots of friends and my patients are inquiring about which one is best, that Covaxin or the Covishield. There are people who are well versed with that. Just rely on them and don't discriminate. My four important messages I would like to share: the be kind, don't discriminate against the people because of all of your fears of the spread of COVID-19. Don't discriminate against the people who think that they will have the coronavirus or tested COVID positive. Don't discriminate against the healthcare worker and health work. They deserve the respect and the gratitude. And finally, the COVID-19 has affected the people from many countries. And don't attribute to any specific group, religion that they are spreading that. Thank you very much, respected Chairperson, sir. Over to you.
Dr. Rahul, just a
Yes.
few words.
Yeah. Now I'm audible.
Yes.
I hope
Visible
I
and
am.
audible.
So my friends, like, it's very important to throw away that attitude kuch nahi hota hai. People should understand that own responsibility towards this COVID pandemic. Follow proper whatever, like masks, follow social distancing. You should follow basic things what led by the government health professionals. So follow that. Second thing, communicate with the people, communicate with your friends. When you're under stress, talk to somebody, reach out to somebody who will really help you to overcome your stress. Communication is very, very important among family members. So now you're working from home. Many people are working from home, so they don't have proper schedule of the day. They're just starting working 9 o'clock in the morning, and they're still like busy 10 o'clock at night also. So proper work schedule should be there. You should have proper workstation at your home. Don't follow proper attire for your working from home strategy. That way you can manage your stress. follow, like as I told you before, like follow meditation, follow yoga, pranayam. Do like family members should come together and offer praying together. That gives optimism. That gives you good confidence also. So all these things like sum up together. You manage your stress on your own, but at the same time take care of yourself, take care of your family, and take care of your country. Binaji, there was some. Hello.
Yes, sir.
Hello.
Yes, sir.
Yeah.
Yes, sir.
Binaji, what is the question actually?
Done.
This was
Okay.
with regards to your experiences, sir, from the COVID.
Can't hear you.
Sir, am I audible?
Yeah. You have said it, Rahul. You have said it. Let's shift to Dr. Ruksheda in short.
So my mom always taught me from a very young age that if you take care of yourself, only then are you capable of taking care of others. I've always learned and believed and practiced that empathy and compassion are the way to go. It heals relationships, whether that relationship is with yourself or with others. And, it's practically my takya kalam that there's no health without mental health. So improve your mental health literacy. Go for professional help if you need it, whether that's me, Dr. Barve, or the regular common people on the road. Take professional help when you need it.
Yeah. I think I will end up by quoting from my favorite poet, Rumi. Perhaps hundreds of years back, he wrote this poem for all of us. He talks about what fear of loss. When we are with you, what fear of loss could we possibly have? When we are with you, what fear of loss could we possibly have? You change every grief to gold. You give us the key to each world we come to. You sweeten the lips of those we love, and you open their mouths in desire. You are beyond all guessing, yet within each guess. Hidden yet beginning to be revealed. We have fallen into the sugar shaker. We are the ground beneath you. Let someone else describe the sky. Hold us in silence. Do not throw us back into some discussion. So I think Rumi said it years back. I'm very thankful to Icon and all of my panelists. We had such a wonderful discussion. It was such a wonderful sharing, and it has brought us all together. And as psychiatry, we are a huge family, small family, but a huge-hearted family. So I'm grateful to all of you to share your personal experiences and also listen to me, my few interpretations. So over to Icon to say something about the Thanksgiving.
Thank you very much, sir. Thank you to all the esteemed speakers as well. As we come to an end of our today's webinar, may I now request Mr. Masood to propose the vote of thanks. Masood?
Yeah, so good evening, everyone. Today I'm down with fever. My voice is choked, but still, I wanted to thank each one of you, sir, for at the brink of pandemic, still you people are taking out your precious time and logging in and enlightening us and the common people also. So this is just like the constellation of stars. They have landed from the sky to the YouTube today. So thank you so much to each one of you. Thanks. That's all what I can say. Thank you so much.
Thank you.
Thank you. Thank you all.
Bye. Bye.
Thank you all.
Thank you, sir.
Bye.
Bye-bye.
Thank
Good
you.
night.
Thank you
Bye.
so much.
Good
Bye.
night.
Bye.
Good night.
Good night. Have a good evening, everyone.
Good
Bye,
evening.
everybody.
Bye, ma'am. Bye, ma'am.
Good
Bye.
evening.
Bye. Bye.
Thanks, sir.